Hello everyone. I hope I'm live. You can see me, you can hear me. Let me check. If you can see me clearly, I'll start the lecture ahead. Give me a minute for confirmation. If you can see me and hear me clearly, you can give me a thumbs up in the chat box. Okay, I hope it is working. Yes. Let me see if I can see your chat. Yes, I can see your chat also. So I welcome you all for today's session. A very good afternoon to all of you. I am Dr. Priyanka Sachdev here, educator on Unacademy. So today I am here to teach you a very difficult topic from pathology, that is hepatitis. So yesterday we have started hepatitis. I will continue and complete hepatitis today from pathology point of view, right? So yesterday we have already started the lecture. But before starting this, you should know the normal anatomy and histology of the liver. Yesterday also I taught you. So yesterday I explained you the normal histology. What is the lobular model of the liver? We have already covered it and I hope most of the students already know it. And we have just started hepatitis. We have covered hepatitis A and hepatitis B we have just started. So I will just revise. In the first 5 minutes, we will take a revision of last lecture, yesterday's lecture. And then we will continue with hepatitis B, C, D, E. A we have already finished yesterday. A, B, C, D, E. Right. After that, I will teach you the histology, histopathology of acute, chronic and fulminant hepatitis. Done? Done? So we have already seen that liver is the largest organ in the body. Liver have two lobes, right lobe, left lobe. The two lobes are separated by various ligaments. You should know the name of the ligaments which are separating the two lobes. Anteriorly it is falciparum ligament, posteriorly it is ligamentum venosum, and inferiorly it is ligamentum teres. We have already seen. The liver is covered by a capsule, Glisson's capsule. You know the dual blood supply of the liver well now. So this is liver. You can see liver is getting pure blood from hepatic artery and impure blood from portal vein. So hepatic artery and portal vein are the two inlets for the blood supply of the liver. And there is one common exit. All the blood coming either from hepatic artery or from portal vein leaving the liver via hepatic vein. Hepatic vein is also known as central vein. So we have already understood this, and liver synthesize bile. So these are the cells inside the liver, hepatocytes. These cells are known as hepatocytes. They synthesize bile. So all the bile is accumulated in bile duct and leave the liver, exit the liver via bile duct, and it opens in duodenum ampulla of Vater, via ampulla of Vater. So please concentrate on liver. There are two inlet, two outlet. What are the two inlet? The two inlet is the blood supply, hepatic artery and portal vein. What are the two outlet? One is hepatic vein, one is bile duct. Out of these four, the three constitute the portal triad. What are the three which constitute portal triad? It is hepatic artery, portal vein and bile duct which constitute the portal triad. Just a second, just a second. You can see it is hepatic artery, portal vein and bile duct. These three will always travel together. So not only these, their branches inside the liver also travel together. You can see in this diagram. So they are entering in the liver at a common point. What three things? Hepatic artery, portal vein and bile duct. They enter and their branches always travel. So it is a tripod. It is a triplet. These are the best friends. It constitutes portal triad we have seen. Now I have explained you the lobular model of the liver yesterday. So if you cut the liver, the entire liver into multiple pieces, you will see entire liver is arranged in multiple hexagonal lobules. So this is a lobule. At the center of the lobule, there is central vein, and at the periphery, you have portal triads having one hepatic artery, one portal vein and one bile duct, right? So these are the portal triads present at the periphery. Everyone give me a thumbs up. Everyone give me a thumbs up. So these are the portal triads which are present at the periphery, So that is portal triad. So this is the diagram I have shown you yesterday also. So this is a hexagonal lobule. Now you have to understand this lobule. Then only I will start the histopathology of hepatitis today. So at the center of each lobule, there is hepatic vein, central vein, and at the periphery, 6 portal triad, each having three things: hepatic artery, portal vein, and bile duct. Red is the hepatic artery, blue is the portal vein, green is the bile duct. Now connecting them is the cord of hepatocytes arranged like a train, the bogies of a train. Between two adjacent hepatocytes, there is a sinusoid, that is a blood capillary which is lined by endos. So this is one sinusoid, this is another sinusoid, and these are lined by the endothelial cells with scattered Kupffer cell. Kupffer cell का आज रोल आएगा Kupffer cell का. So you can understand it like this. Everyone see here, everyone. So this is one train having a cord of hepatocyte, and this is another train having another cord of hepatocyte, another train. You can see, and between them, this is the sinusoid. This is the sinusoid which is lined by endothelial cells and scattered Kupffer cell. And there is a space which is known as space of Dissay, the space between the hepatocyte and the endothelial cell. It contains a special cell known as Ito cell. Ito cell convert into myofibroblast and cause the fibrosis. So this is the diagram we have framed yesterday. You know what are sinusoids, what is space of Dissay. Space of Dissay contains Ito cell. I have explained you all this in yesterday's lecture. This is just a revision. So this is the final diagram of the liver. In the final diagram of the liver, I have drawn one central vein, and instead of drawing 6 portal triad, I am drawing only one. So in the hexagonal lobule at the center, there is central vein. So this is one. And at the periphery, there are 6 portal triads. I am not drawing 6, I am drawing only one. So one of the portal triad having hepatic artery. So you can see this is artery, this is vein, portal vein, this is bile duct, having a portal triad. Connecting between them are the cord of hepatocytes. So these are the cord. Now you have to understand this diagram. Today I will teach you acute hepatitis, chronic hepatitis and fulminant hepatitis in this diagram only. So this is our master diagram. This is going to happen our master diagram. You can see these are the cord of hepatocytes. Now listen, the first hepatocyte of all cords, this one, the first hepatocyte of all cords, please concentrate this one, which is present just near the portal triad. This is known as limiting plate. Limiting plate. So it is a plate which separates the portal triad from rest of the hepatocyte. You have to understand this limiting plate because in chronic hepatitis, necrosis starts from limiting plate. So I will use these terms when I will teach you the histopathology of hepatitis. Have you got it? Have you got it? We have understood this. So let me teach you hepatitis. This was the general. I have taught you this yesterday also. So without which you cannot understand hepatitis actually. So okay, let me move on hepatitis. We have started hepatitis yesterday. Are you people there? Everyone give me a thumbs up. So we have completed, there are 5 types of hepatitis. We all know hepatitis A, B, C, D, E. All of them are caused by viruses. The 5 viruses. So hepatitis A is caused by hepatitis A virus, B is caused by B, C by C, D by D and E by E. So 5 viruses are there. Out of the 5 viruses, only hepatitis B is a DNA virus. Rest all are RNA, 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 RNA. It is an important MCQ you have to learn. You have to learn. We have seen this yesterday also. Everyone give me a thumbs up. Everyone. So this was the revision of yesterday's lecture. Those who were not available yesterday, for them this is the revision. Everyone give me a thumbs up. So I taught you that there are 5 hepatitis. Hepatitis A, B, C, D and E. Today I will give you detail of all 5 along with acute, chronic and fulminant. Right. Listen. So the 5 type of hepatitis is A, B, C, D, E. Among them, all of them are caused by viruses. So what is the name of the virus causing each of them? A is caused by A virus, B is caused by B, hepatitis B virus, C is by C, D by D and E by E. Everyone knows this. Okay. Only B is DNA virus. Rest all are RNA virus. You also know this. I guess you also know this. The next point is the route of entry. How this virus is entering human body and reaching the liver. What is the route of entry? Yesterday I taught you very clearly A and E enters by fecal-oral route. So contaminated food and water, it will enter in the mouth, esophagus, stomach, intestine and it will be absorbed. It will go in the liver, in the blood and from the blood it will reach the liver. And in the liver it will cause hepatitis. So it is the fecal-oral route, right? And the person will excrete the virus in feces and another person will ingest the virus in contaminated food and water. That's why it spread from one person to another. But what about BCD? What about BCD? B, C and D spread by, not by fecal-oral route, 3 routes. Number 1, sexual route. Sexual route. Number 2, parenteral. What do you mean by parenteral route? Parenteral route means it spread either via blood transfusion, blood products or needles, contaminated needles. If I am using a needle in one person having hepatitis and without sterilizing, if I am using the same needle or any products in the another healthy person, so that healthy person will acquire hepatitis from that contaminated person. So this is the needle. I'm really sorry. This is the needle stick injury, which is transmitting the infection either by sexual or parenteral or vertical. By vertical, I mean placenta. It can transmit from mother to fetus via placenta. So these are the 3 routes for BCD. It is not fecal-oral. If you've understood the route, the next point which I have explained you yesterday, the next point I will tell you in yesterday's lecture, I taught you this very clearly. Listen. A, B, C, D, E all can cause acute hepatitis. Acute hepatitis can be caused by all 5. Acute hepatitis. The most severe form of acute hepatitis is fulminant hepatitis. So of course, fulminant hepatitis is also caused by all. In fulminant hepatitis, persons dies. It is the most severe hepatitis, the most severe form of acute. So only 1% of the acute will convert into fulminant. So acute and fulminant hepatitis is caused by all five. Do you have any doubt in that? What about chronic? What about chronic? Chronic hepatitis is caused. Chronic hepatitis, just a second. Chronic hepatitis is caused only by BCD. So chronicity is only seen in BCD. Chronicity leads to carrier state also. So carrier state also seen in BCD. Chronicity also leads to HCC, hepatocellular carcinoma. So that is also seen in BCD as a complication. And chronicity leads to cirrhosis also. So that is also seen in BCD. So A and E do not have chronic, do not have carrier, do not have cirrhosis, do not have HCC. Please learn. If you have understood this, then we can go ahead. Everyone give me a thumbs up. Everyone. First, I want a thumbs up from each of you, then I will proceed ahead. So these are the overview of the 5 type of hepatitis we have seen. The same table is given to you here also. So you can see the route, it is feco-oral, and rest of them is parenteral, sexual or vertical. This is the route. Okay. So we have seen all 5 can cause acute, but chronicity is caused by BCD only. It is caused by BCD, not by A and E. Chronicity, carrier state, hepatocellular carcinoma, all is caused by BCD, but not with A and E. Everyone give me a thumbs up. Okay. So let me proceed. We have seen that only B is DNA, rest all are RNA. We have seen this. You have to learn the name of the family of each virus. These are viruses now, so they have peculiar family. A, C, D, E are RNA virus. But RNA virus में कौन सा family? Name the family. And B is a DNA virus. But which family of DNA virus? So A belongs to enterovirus picornaviridae family. B belongs to hepadinavirus. C belongs to hep C or flavivirus. D belongs to viroids. And E belongs to calcivirus. Everyone give me a thumbs up. Everyone give me a thumbs up. These are the incubation periods you have to learn, and routes I have already taught you. Right. So hepatitis A. Let's see an overview of hepatitis A, then I will move on B. In hepatitis A, it is caused by RNA virus belonging to Picorna family. We already know it. Mode of infection is feco-oral. We already know it. Incubation period 2 to 6 weeks. We already know it. It caused only acute, no chronic. One more thing I forgot to tell you there. A, B, C, D, E. So all causes acute. Okay. All causes acute. All causes fulminant. A, B, C, D, E. All causes fulminant. The most severe form of acute is fulminant. But chronic is only caused by BCD. Okay, this I have taught you. So A and E do not cause chronic, right? A and E do not. So A is the most common cause of acute in children. Learn it. And E is the most common cause of acute in adults. Learn. These both are MCQs. Everyone give me a thumbs up. So learn. A is it's causing only acute, right? Rather, it is the most common cause of acute in children. Most common cause of acute in children. Most of the time, the infection is self-limiting and benign, right? It do not cause chronic, do not cause carrier, do not cause cirrhosis, do not cause HCC. Please understand. You have already understood it. So just suppose there is a child in my OPD having jaundice. He is coming with the parents and the parents are complaining, doctor, my child is having jaundice. He is yellowish everywhere. The skin sclera is yellowish. He is having loss of appetite and he is having abdominal pain. Right side abdominal pain. He is having these 3 complaints. The child is coming to me. The child is coming. So the first suspicion I will have, the child is having hepatitis A. Hepatitis A which spread by feco-oral route. There is no sexual route in children also, in hepatitis A also, right? So it is spreading by feco-oral route. So for confirming what investigation, for diagnosis, what investigation I will order? I will ask the parents to take the blood sample of this child in a test tube and the stool sample of this child in a container. So the stool and blood both contains the virus. Which virus? Hepatitis A virus. It is present in the blood first and later on it is present in stools also, right? So in the stool, in the blood, the virus is present. But blood contains along with the virus antibodies. The body is forming antibodies. Virus is a foreign thing. Anything foreign entering human body will form antibodies. So it will be antibodies also you will find. So you will find anti-HAV antibodies, anti-hepatitis A virus antibodies. It is of 2 types, IgM and IgG. So in short, blood have 3 things. What are the 3 things present in the blood? These are the 3 things present in the blood, the virus and the 2 antibodies, and stool have only virus. So by both ways, you can confirm your diagnosis and give the treatment if required. Otherwise, it is a self-limiting illness. Everyone give me a thumbs up. So blood contains HAV virus present in blood also and in stool also, right? First it is present in blood and later on it will present in the stools, and antibodies are present in blood. Now what is the relevance of two antibody? IgM will come at that point and go away, but IgG will remain forever. IgG will, so you can see the three things in front of you. Red is the virus. So virus will present in the blood as well as the stool and it will go away. Once it will go away, so the child is treated. It is a self-limiting treatment, or with treatment it will go away. You can see, right? The purple color, you can see it is the IgM. It is coming and it is going. After some time it will go. But see the blue one, IgG, it is coming and remaining in the blood forever. Forever. So just suppose there is a child in my clinic, he is absolutely healthy, nothing. If I am taking the blood sample of this child and checking for IgG, anti-HAV antibodies, and he is positive for IgG, it doesn't mean child is having acute hepatitis A. No, in the past he was having infection. So IgG remains in the blood forever. So in future also this will be positive, but others will be negative. So diagnosis is based either on IgM and the virus, not on IgG. Only IgG. Only IgG indicates past infection. Give me a thumbs up. So these all things will be useful in solving clinical scenario based questions, right? Let me come on hepatitis B. Yesterday we have started hepatitis B, but we were in the middle, we couldn't complete it. So today we will complete it and move on hepatitis C, D, E and acute chronic hepatitis. I will be a little bit fast as this was a revision portion. Give me a thumbs up. Everyone give me a thumbs up if you are with me. So hepatitis B virus. So we know that hepatitis B virus is a DNA virus. Rest all are RNA. So see, this is the diagram of hepatitis B virus. It is known as Dane particle. Dane particle based on the name of the scientist who has discovered it. Dane particle. You can see it is double-stranded DNA. Double-stranded DNA in the nucleus, right? This is the capsid and this is the envelope. You can see the capsid, you can see the envelope. So this is the diagram. On this virus, three antigens are present. See, three antigens. The first antigen is S. S for surface. This is the first antigen. S is for surface. Second antigen is E. It is present on the surface. E is envelope. E is envelope. It is present on the envelope. That's why E. And third is C. C for core. It is present in the core. That's why C. Have you got it? There are three antigens. See, these three are antigens. So if this virus is entering in human body, this is the blood vessel of human body. So this virus is entering in human body either sexual route or parental route or vertical route. It is entering. So it is present in the blood vessel. So out of these three antigen, two will dissolve and come in the blood. Which two will dissolve? The surface antigen S will dissolve and come in the blood. First it will dissolve and then E will dissolve and come. Along with E, DNA will also dissolve. This double-stranded DNA, it will also come along with E. So in the blood, you will find S separately, S antigen, E separately and along with E DNA. But C never comes in blood. C is in the core. It is present inside. It will never come in the blood. Give me a thumbs up if you got this point. These are the big concepts you are framing now, right? So C never comes in blood. So in the blood, you can find S, you can find E and you can find DNA. These are the antigens. So whenever any foreign thing enter in human body, body will form antibodies against it. So antibody कौन से antigen के against बनेगा? Body will form antibodies against all three. Body will form antibodies against all three. So against S also, body is forming anti-HBs antibody. So this is antigen, body is forming antibody. So HBs antigen के against anti-HBs antibody, right? In the same way, E के against, HBE के against, HBE antigen के against anti-HBE antibody. So these two were coming in blood. So body is forming antibodies against them. But C is not coming in blood. Still body is forming antibodies against them. It is foreign. So body is forming antibodies. So anti-HBC antibody. Anti-HBC is of two types, IgM and IgG. Anti-HBC is of two types, IgM and IgG. And these two are of not any type. It is of one type only. S and E are of one type. So total 4 antibodies are there. So at the end, what we have, how many antigens we have and how many antibodies we have in blood. In blood, you have two antigens. How many antigens? Two antigens. Name them. It is HBs antigen and HBE antigen. C will not come in blood. So that is about antigen. What about antibodies? How many antibodies are present in the blood? There are 4 antibodies present in the blood. One is against S. So anti-HBs antibody. Anti-HBs antibody. One is against E. So anti-HBE antibody, right? C is not coming in blood, but its antibody will be formed and it is of two types. So HBC antibody is of two types, IgM and IgG. These all 6 things. What are the 6 things here? You tell me. 2 antigen and 4 antibodies. 2 plus 4. Total 6 markers are there. These are the 6 serological markers of hepatitis. Hepatitis B. Everyone give me a thumbs up. Everyone. Have you got it? Among these markers, you should understand two things. What is the sequence of arrival? In which sequence they are coming in the blood? Number one. And number two, after coming in the blood, what is the significance of each of them? So I will give you many clinical based scenario questions today to solve it. Everyone give me a thumbs up. Everyone. Have you got it? Have you got it? So this is the sequence in front of you. Let me see if I can see your chat. Okay. Uh, just a second. It will take a second, I guess. So I guess I can see your chat is hanging actually. Just a second. Last second. Yeah. So I can see it. So what is the sequence? What is the sequence of arrival? Who will tell me? So first antigen will come, of course, after that antibody will come. So there are two antigen now. So what is the sequence of those two antigen? So first antigen S is coming, S, and then E is coming. Along with E, DNA also come. Along with E, DNA also come. So first S is coming, then E is coming. This is the sequence of antigen. Please learn. Please learn. SE is the mnemonic for antigen. First S, then E. Now come on antibodies. What is the sequence of antibodies? Now the third antigen, what is the name of the third antigen? C. C never comes in blood. Only S and E is coming. So C को बुरा लग गया. तो antibody सबसे पहले उसकी बनेगी. Just learn like a story, right? So body is forming antibody first for the C. So the first antibody which come is C. Now C have two types of antibody. So first IgM is coming. IgM. Then E. E की antibody will come, right? Then again C की IgG will come. And then last में S will come. You can see anti-HBC, IgM, then HBE, then anti-HBC, IgG, and then anti-HBS. So S is the first antigen to come. Its antibody is last to come. Last to come. So let me summarize. Let me summarize. What is the sequence? The ultimate sequence is SE for the antigens. For the antigen, C E C S for the antibody. Now please learn. However you want to learn, please learn. If you want this mnemonic, take it. If you don't want the mnemonic, learn directly. So this is the sequence for antigen and this is the sequence for antibody. So you will say, ma'am, C आपने antigen में नहीं लिखा है. C never comes in blood. That's why it is not an antigen, considered not an antigen. But its antibody is formed. The second question you will ask, ma'am, you have written two times the C. Why you have written two times? The first is IgM and the second is IgG. Do you have any doubt till now? Do you have any doubt till now? Should I proceed ahead? So see the two antigens and see the four antibodies. Everyone see the two antigens and the four antibodies. So this is the sequence. So you can see the two antigens are coming and its four antibodies are coming. Now you can see the same sequence shown here. So in this diagram, you can see the first antigen coming is HBS. This is HBS. After that HBE and DNA, they are coming together. After that C ki IgM antibody, it is coming here. After that E ki antibody is coming here. After that, C ki IgG antibody is coming and remaining forever. G will remain forever. And in the last, anti-HBS antibody is coming and remaining forever. So these two remain forever. These two antibodies will remain forever. The last two antibodies, these two will remain forever. They will come and they will go. But these two will remain forever. Do you have any doubt in this graph? Now, in this era in which image-based question is always a pattern of your all competitive exam, NEET PG, FMG, ICT, next you get image. So this graph is a vital area from which a very good image based question can be created. I can create 100, more than not 100, but 20-30 questions based on this particular graph. In this one graph, I can create many questions. So I will give you the graph and ask you multiple questions based on it. That will be conceptual. If you know the concept, you can answer any question. Have you got it? Have you got it? So okay. So the next thing, what is the relevance of each of them? Just a second. Okay. What is the relevance of each of them? What is the relevance of each of them? Let me tell you the relevance. Okay. First, tell me the sequence. Who will help me for the sequence? It is hepatitis. Uh, uh, what is the sequence? Who will tell me? For the antigen, it is HBS and HBE. Antigen. Antigen. And what is the antibody? It is anti-HB, the four antibodies. Anti-HB, anti-HB, anti-HB. What are the four sequence? It is C, E, C, S. Right? Here it is, these are the antibodies. Antibodies, not antigen. These are the antibodies. This is IgM and this is IgG. If you don't have any doubt till now, listen the significance of each. This is the sequence. Now I will talk about the significance one by one. I will take pair. So first I will take a pair of S ka antigen and S ki antibody. What does they indicate? S ka antigen or S ki HB S ki antibody. What does they indicate? So S ka antigen indicate infection. Now whether acute and chronic I don't know, whether carrier I don't know. Infection acute hai, chronic hai, fulminant hai or carrier hai I don't know, but infection is certain. If S antigen is present means infection, and if its antibody is present it means recovery. The patient is recovered. It is no more infection, it is recovery. It is recovery, either recovery or vaccination immunization also gives this serology, or protection. The person is having protection for the HBs antigen because vaccination provides protection. Recovery, vaccination, protection. Now the two things cannot happen together. Either the person will have infection or the person will have recovery. So both will not come together. So in the blood sample, either you will get SK antigen or you will get SK antibody. Do you have any doubt in it? Do you have? And S is the best marker for epidemiology. If you want to study the epidemiology for hepatitis C S antigen in all the population, whoever is having S antigen positive, he is having hepatitis. But whether acute, chronic, fulminant, we don't know, but he is having hepatitis, right? Have you got it? Now the second question arises that, madam, whether it is acute or chronic. You are saying only infection, but you are not giving no idea about whether it is acute or chronic. So acute or chronic is given by C. Now we don't have antigen for C. We have two bodies for C, antibodies for C. One is IgM, one is IgG. If IgM is present, it is acute. Acute or recent infection. Acute or recent infection. If IgG is present, it is chronic. Chronic or past infection. Everyone give me a thumbs up. So first look in the serology, first always have a look on S. Whether S antigen is present, antibody is present. If antibody is present, no matter to go ahead. The person is already recovered or vaccinated or protected. No need to see anything else. But if S antigen is present, it means infection. Now, if the infection is present, the second question you have to answer whether it is acute or chronic. So C ki antibodies, the C ki antibodies, right? If it is IgM, it is acute or recent. If it is IgG, it is chronic or past. Everyone give me a thumbs up. Now the third question which should come in your mind, that madam, this patient is infective. Of course, hepatitis is spread from one person to another. It is infective. Like COVID, it is infective. So what is infectivity? Whether this person is highly infective or low infective. That is the significance of E. E ka antigen or E ki antibody. See the pair. C ka antigen or E ka antigen or E ki antibody. Envelope E. So if antigen is present, means infectivity is high. Infectivity is high. And if antibody is present, means infectivity. Infectivity. I'm not talking about infection. I'm talking about infectivity. You understand the difference between infection or infectivity? If the person is having infection, he will be infective to others. उसको खुद को तो infection है, लेकिन वो दूसरों को फैलाएगा, वो infectivity है. So high infectivity or low infectivity. So see the pairs. See the first pair. The first pair is S. S indicates either infection or recovery. They never occur together. Either you will get antigen or you will get antibody. The second is C. C ki antibodies are there. There are two antibodies of C, IgM or IgG. So if IgM is present, it is acute. IgG present, it is chronic. The third is E. E ka antigen or E ki antibody. E ka antigen indicate high infectivity, antibody indicate low infectivity. So you will be able to solve any clinical based, scenario based question based on this information. Now you can't believe I am having a lot of more than 50 big clinical questions based on this profile. So in some questions I will give you this positive, rest of them are negative. This is positive. This is, so I will give you various combinations and you have to answer the question. Have you got it? So we will solve some of them, not all, but some of them. Everyone first give me a thumbs up if you got two things. Number one, the sequence of the serological markers in hepatitis, and number two, the significance of each of them. If you have got the both the things, just a second, then I would like to launch some polls based on this information. Yes, who is this? Yes, Nikita, you are absolutely right. One more point Nikita has reminded me, I just forgot to mention, is that this E ka antigen and antibody, along with infectivity, it indicates replication. Why the person is more infective? Because viral replication is more. That's why he is more infective. Why the person is less infective? Because replication is less. So it is also a marker of replication. E के साथ DNA भी आता है. I have told you that when E comes, along with E, DNA also comes, virus DNA. So both of them are markers of replication. But DNA is the quantitative marker for replication and E ka antigen and antibody are qualitative markers for replication. But both of them are markers of replication. The best marker for replication is quantitative DNA, but it is very costly, so nobody does it in clinical practice. But the qualitative marker, the most common marker which is for replication is E ka antigen and antibody. That is a qualitative marker. Everyone give me a thumbs up. Everyone. So the same story is written in front of you. Please everyone appreciate the sequence and the significance of each of them. Do you have any doubt in this? Everyone see this diagram. There are 3 antigens in this virus. This is a diagram of hepatitis B virus. Let me summarize. Hepatitis B virus, the diagram is in front of you. There are 3 antigens and 4 antibodies, right? What are the 3 antigen? Antigen S for surface, E for envelope, and C for core. Core never come in blood. So only 2 come in blood, S and E, 2 antigens. And antibodies, so antibodies against S also, against E also. C do not come in blood, but it antibody are present in blood. So antibodies of 2 types, C ki, IgM, IgG. So 2 antigen, that is S and E, and 4 antibodies. For S and E की तो है ही and C की 2 type IgM IgG. So 2 plus 4 total 6 markers we are having for hepatitis. What is the sequence? What is the sequence for antigen? The sequence is S and E. For antibody, this is antigen, huh? S ka antigen and E ka antigen. That is antigen, right? For antibody, the sequence is C, E, C, S. So that is C ki antibody. All of them are antibodies. All of them are antibodies, right? C ki antibody, E ki antibodies, right? But C, the first C is IgM and the second C is IgG. IgG. There are 2 types of E. So this is the sequence SECECS. This is the mnemonic. However you learn, it's your wish. I have told you the significance for each of them. We are done. S indicates infection, the antigen, and its antibody indicates recovery or vaccination or protection. That is the significance of S. Take this pair and cancel it out. You got the significance. Antigen indicates infection, antibody indicates recovery. We have done it, right? Take the second pair, C ka IgM indicates acute infection or recent infection, or IgG indicates chronic or past infection. So cross this pair. You know the significance of this. Last is E. The third and the last is E. You know E. E indicates infectivity. So E indicates infectivity or replication. You got it? So E ka antigen indicates high infectivity or high replication, right? And antibody indicates low infectivity or low infection. If you have got this, you have to give me the answer of 6 questions. I will ask you 6 questions. Now, don't look at the answers. You don't look at the answers here. See the clinical scenario. Now, there are 1, 2, 3, 4, 5, 6, 6 patients in your clinic. One by one, we will deal with all patients. So, this is my patient number 1. See the report of this patient. This is my patient number 1. Let me correct it. This is antibody. This is antibody. And this is also antibody. By mistake, it is written antigen. So you are given the profile. See the first antigen, first patient. This is patient number 1. This is my patient number 1. In first patient, you tell me the diagnosis. Okay, don't read it. Just conclude it by yourself. So S ka antigen is positive. So patient is having infection. If antigen is positive, obviously antibody is negative. So there is no recovery. Patient is having infection, no recovery because antibody is negative. Let me come on E. E ka antigen is positive, antibody is negative, right? So it is of high infectivity. Patient is having infection of high infectivity. Let me come on C. In C, IgM is present. So it is acute. So my answer is acute hepatitis B infection of high infectivity. This is my diagnosis. Everyone give me a thumbs up. Everyone. Look at the scenario of patient 2. This is my patient 2 in my clinic. So same scenario. Here also patient is having HBs antigen positive. So he is having infection. No recovery. It is of low infectivity because anti-HB E antibodies are there and it is acute. So acute HBs of low infectivity because instead of HBe antigen, we are having HBe antibody. Give me a thumbs up. See the next 2 patients, patient number 3 and patient number 4. In both of them, instead of IgM, there is IgG. So both of them are chronic. One is high infectivity because E ki antigen is present. One is of low infectivity because E ki antibody is present. Have you got it? And in both of them, infection is there, no recovery is there. Now, the most important and difficult to understand is patient number 5 and 6. Let me come on 5. See patient number 5, I am marking with green marker. See patient number 5. Everyone see patient number 5. In patient number 5, and HBs ka antigen is negative. So there is no infection. Antibody is there. So you have to decide whether recovery or immunization. There are 2 options now, either recovery or immunization. So what is the difference? Here also in patient number 6C, antigen, S ka antigen is negative, antibody is positive. So in both of them, infection is no more. Now either there is recovery or there is vaccination. How you will differentiate? In vaccination, only antibodies present, rest all is negative. Only anti-HBs antibodies present. But recovery may along with anti-HBs antibody IgG be present hogi na? IgG will present forever. So that is the only difference between recovery and immunization you can notice. Everyone give me a thumbs up. I really tried hard. Everyone, everyone. So E indicates infectivity and replication. High infectivity and low infectivity. If antigen is there, high infectivity, antibody is there, low infectivity, right? And anti-HBs antibody indicates either immunization or vaccination, right? Or protection. Give me a thumbs up. So that is all about the clinical significance of each of the marker. If you have got it, you already know the route of spread. I'm talking about hepatitis B. So hepatitis B spread from one person to another via three routes. So this is a person having hepatitis B. He is a known case of hepatitis B, right? He is a known case of hepatitis B and he is a healthy person. The second person is a healthy person. He don't have. So this person can spread the infection to this person, number one, via sexual route. It can spread sexually, sexual route. Number one. Number two, if I'm using some blood, if I'm taking the blood of this person and transfusion to this person, blood transfusion, or if I'm using the needles in this person and without sterilizing the same needles to this person. So this route is known as parental route, parental route. And third, not between two person. The first person is a lady and she is pregnant. So that is the uterus of the lady. And inside the uterus, this is the baby. See, this is the baby, this is the fetus inside the uterus. So via placenta, it can go to the fetus. So mother to fetus via placenta, that is the third route, it is vertical. Everyone give me a thumbs up. So there are three routes. Parental via blood products, blood transfusion, needle stick injury. Most common route is this only. Second is sexual transmission, sexual intercourse, if male, female or homosexuality. And third is vertical, from mother to children to fetus via placenta. Give me a thumbs up. Incubation period is 1 month to 6 months. इस पे बहुत बार MCQ आ चुका है. For hepatitis B, you have to learn. You have to learn. Hepatitis B virus is present in all fluids. So it is present in vaginal fluid also. It is present in semen also. That's why it is transmitting sexually also. It is present in saliva also. It is present in saliva also. So it can transmit from one to another person via sexual route. So it is present in all body fluids but not in stool. So it cannot spread via fecal-oral route because this is not present in stool. But remember, hepatitis A virus was present only in stool, not in other fluids. B is present in all other fluids of the body but not in stools. Have you got the difference? Give me a thumbs up. Now remember A. A can cause only acute, no chronic. Here A can cause acute also. A can cause chronic also. The two type of chronic I will tell you. The A can cause fulminant. B can cause fulminant also. I'm talking about B. This one is B. Huh? B can cause acute also, chronic also, the most severe form of acute fulminant also. It can cause carrier also because chronicity leads to carrier. It can cause hepatocellular carcinoma also. It can cause cirrhosis also. Everyone give me a thumbs up. That is the clinical presentation of B. So patient can come to you at any stage, right? So this is the patient with hepatitis B. Hepatitis B. Now you don't know whether the patient is having acute infection. Acute होगा तो the patient का symptom होगा jaundice. Patient will come to you with jaundice and fever. If the patient is having fulminant, he is very sick. Along with jaundice, fulminant, he is having multiple problems and the patient is really deadly, right? That is fulminant, most severe form of acute. In chronic, patient will not have jaundice, patient will not have fever. Sorry, just a second. Patient will come to you with complications. So patient usually comes with ascites. So you will find the cause of the ascites. It can be cirrhosis. It can be hepatocellular carcinoma. It can be there. Or patient can come as a form of patient nahi hai, ye carrier hai. So he himself is asymptomatic and spreading other to the community members. So that is carrier. So anything can be possible. So depending on that, you have to do your profile. In the profile, 6 markers will be there. Based on the result of those 6 markers, you will decide whether the patient is having acute hepatitis, acute and fulminant, the profile is same. Chronic hepatitis, whether the patient is carrier or whether the patient is immunized. That you will decide. Of high infectivity or low infectivity. That you will decide. Have you got it? Everyone give me a thumbs up if you got it. You have to notice the percentage out of total 100 patients. At least 65% of the patient will present with subclinical infection. They even don't know they have hepatitis B. Just suppose I am having hepatitis B, even I don't know I have and it will go from my body. It is subclinical. वो clinical भी नहीं हुआ. So 65 and 100% will recover. So they even don't know they have hepatitis B at some phase of life and they already recovered. They don't have even a single symptom. That is subclinical, right? 25% will have acute. They will have jaundice. They will have fever. But 99% of them will recover. 1% of them will convert into a more severe form of acute, that is fulminant. And fulminant results in death or transplant. It is the most severe acute. The entire liver is involved. Give me a thumbs up. So that is acute. So 65 present with subclinical, 25 present with acute. What about the next 5 to 10? Only 5 to 10 present with chronic. And chronic will result in cirrhosis or hepatocellular carcinoma. Everyone give me a thumbs up. Chronic में recovery के chances are very less. Chronic में, acute में recovery के chances are 99%. But chronic में recovery के chances are nil. Either they will convert in cirrhosis or hepatocellular carcinoma. That's why they will present with ascites to you. Everyone give me a thumbs up. I tried hard, right? So we will do some polls based on this information. Then we will move on the next hepatitis, hepatitis C. We are done with A. We are done with B. Are you people ready for the poll? Are you ready, people? So read the first question. Let me see if I can see your chat. Okay. Okay, so I can see it. So this is first question in front of you. Please read the question very carefully before giving the answer. Don't rush. I'm asking the first antibody to appear in blood in hepatitis. Hepatitis B. Hepatitis B. First antibody, not the antigen. Who will give the answer? The four options are in front of you. The four options are in front of you. First, please see the approach. Decide whether E or C or S. Which antibody will come? All of them are anti, 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 anti. Which antibody will come? Then decide G and M. Then decide G and M. So what is the sequence in antibody? What is the sequence in antigen? In antigen, what is the sequence? In antibody, what is the sequence? I told you very clearly. Who will give me the correct answer? So most of the students already trying. Iram, Alphos, Rishinika. Yes, you are right. For antigen, the sequence is S and E. But the question is not about the antigen. For antibodies, the sequence is C, E, C, S. C, the first C is IgM and the next C is IgG. So this is the first antibody which come in blood. Now look in the options where it is given. So it is IgM anti-HBC. Anti-HBC ka IgM. So correct answer is C and you all are right. You all are right, right? After C, E will come. E will come after C. S will come in the last. If instead of first, if I change the question and asking the last will be the S. लेकिन S का IgM IgG नहीं होता, ना ही E का IgM IgG होता है. They don't have two variants IgM IgG. IgM IgG is only variant of C. Have you got it? Have you got it? Yes, C is the correct answer and you all are right. I'm happy that you got the concept. Now these questions are considered as difficult questions. These are not easy level. There are three difficulty levels, na? Easy, moderate and difficult. So I will put it in moderate question, not an easy one, not a very difficult one also, but it is a moderate question, right? So no, anyone cannot solve it, right? Those who have the concept behind it, they can solve it. If you don't know anything, looking at the four option, it is highly confusing. So you will get confused if you don't have the detailed knowledge of it. Have you got it? Okay. So let me move to the next question. This is the next question in front of you. Recent hepatitis is best diagnosed by. Mind the word recent. Please mind the word before answering. Please mind the word recent. I want to diagnose recent hepatitis, not the past one. Recent means acute. So which of the following marker will give me a best diagnosis that the hepatitis is recent? The four options are in front of you. Whether it is HBS antigen, whether it is IgG anti-HBe antibody, whether it is anti-HBs antibody or IgM anti-HBC antibody. So I have told you, yes, you all are right. Very good. So what is the answer here? So there are two antigens and four antibodies. Sequence of antigen is S and E and sequence of antibody is CECS, right? This is IgM and this is IgG. So recent and past, the significance is given by C ka pair. So IgM is recent or acute and IgG is chronic or past. So here the question is about recent. So answer will be D. Answer will be D. Have you got it? Answer will be D. Instead of it, if I ask past, answer will be IgG. लेकिन E का नहीं C का. So options are very confusing. Have you got it? So correct answer is D and you all are right. Thankfully, you got the concept. So that is the thing. Let me move to the next question. Now here two questions are there. Listen, you have to give me two answers. Let me ask them one by one. Don't read, don't rush. Listen. Let me correct the question. It is not infection. Infectivity, I want to ask. Infectivity or multiplication? Please do the correction. It is infectivity or multiplication. I want to ask which is the marker for infectivity or multiplication. Two questions are there. Which is the best marker for infectivity or multiplication? First answer that. And after that, you give which is most commonly used for infectivity or multiplication. Two questions are hidden in this question. Both have different answers. You give me answer for this. You give me answer for this. For infectivity or multiplication, what is the answer? What is the answer? So most of the students have already given the answer. So best is DNA. Best is DNA. Have you answered DNA? Best is DNA, but it is quantitative, because it is quantitative, and but it is costly. So we do not perform it. Most commonly marker is E. E is the marker. E ka antigen indicates infectivity and antibody indicates low infectivity. So A, that is HBE antigen. This is a qualitative marker, but it is used most commonly. It is cheap. Have you got it? So if I ask best, your answer is this. If I ask most commonly, your answer is this. Everyone give me a thumbs up. I don't know whether you are right or wrong, but this is the concept. Take the concept. Take home message. Take concept. So that is the thing. This is the next question in front of you. Again, a very tricky. Very few students will be right. Most of you will fall in the trap. Don't fall in the trap. Listen the question carefully. Anti-HBs antibody indicates what? The last antibody which is coming in the blood. Anti-HBs. SK antibody indicates what? What does it indicate? What is the significance? Does it indicate resistance to the infection? Does it indicate acute infection? Does it indicate good prognosis? Or does it indicate the person is having hepatocellular carcinoma? What you will say? What you will say for this question? What you will say? I have to log in again. Give me a minute. Your chat is gone. Meanwhile, please answer. Okay. So many students are saying A. Rishinika, Abhinash, Iram and Tuki. You are saying A for this question. What about others? Please everyone participate. What does this antibody indicate? What does this antibody indicate? Yes. So some students are saying C also. See this. Nikita, Shoaib. Some students are saying C also. Iram. So answer the confusion. Most of the students have confusion between A and C. What is the correct answer? So S indicate resistance or prognosis. S has nothing to do with prognosis. Please see my recording previously. I have not used the word prognosis. SK antibody indicates three things I have said. It indicates recovery. Recovery doesn't mean good prognosis. Please don't get confused. It indicates recovery, number one. It indicates vaccination or immunization, number two. And it indicates protection, number three. It has nothing to do with prognosis. It do not indicate acute and chronic. Acute and chronic indicated by IgM and IgG of anti-HBC, right? It do not indicate hepatocellular carcinoma. It indicates protection. Protection means resistance. Protection का मतलब क्या होता है? I am protected for hepatitis B because I am vaccinated. So I am having resistance for the infection. So instead of protection, the examiner has given you the word resistance, one and the same thing. So correct answer here is A, not C. So those who have answered C, have you realized your mistake? And you will not commit this mistake again in the exam? Yes. So correct answer is A. It is the resistance. It indicates resistance or protection. Have you got it? It do not indicate prognosis. Everyone give me a thumbs up if you got this point. Everyone, those who are wrong especially, please give me the thumbs up. So let me move to the next hepatitis. Okay. The next third hepatitis I am moving now. Hepatitis A, B, I am moving on C. Hepatitis C. Let me move on hepatitis C. So I'll be a little bit fast. C is known as non-A, non-B. It is non-A, non-B. Non-A, non-B virus. Hepatitis C virus, it is non-A virus, non-B virus, and it also transmit parenterally, like hepatitis B. Parenterally means via blood transfusion or via needle stick. It is a RNA virus which belong to Flaviviridae. You know the families, right? Only B is DNA. Rest all are RNA. Okay. What is the mode of transmission? Again, those three. You know sexual. You know perinatal, matlab vertical via placenta, and parenteral. Parenteral means infectious blood products, blood transfusion, needle stick injury, syringes, injection, right? So these are the parenteral. Give me a thumbs up. Incubation period you have to learn for all, right? It causes acute also, it causes chronic also, right? Like B, it causes acute and chronic both. But here see the percentage. If you remembered, in B, what was the percentage of acute and chronic in B? In B, 65% were subclinical. Only 25% were acute. 25% were acute and 5 to 10% were chronic, out of which most of them were converting into HCC and cirrhosis. If you remembered the last flowchart, everyone give me a thumbs up if you remember this. Now compare it for C. For C, in C, 80% will convert into chronic. 80% and 20% will be acute. There is no subclinical. So see the comparison. Here acute ka percentage is only 10. Here acute ka percentage is, oh sorry, chronic ka percentage is C. And that C, the chronic will always convert into HCC and cirrhosis. The chronic convert into HCC and cirrhosis. Give me a thumbs up. So which is more dangerous according to you? According to this knowledge, which is more dangerous, B or C? Which is more dangerous? Write in the chat. Which is more dangerous, B or C? वैसे तो दोनों ही अच्छे नहीं है, फिर भी कौन ज्यादा बुरा है, बी और सी? सी, क्रोनिसिटी इज बैड, क्रोनिसिटी लीड्स टू एचसीसी एंड सिरोसिस। हम एक्यूट से नहीं डरते, एक्यूट होगा तो 99% रिकवरी इज श्योर, only 1% is fulminant, but 99% recovery is sure. Here recovery is not sure. If you have chronic hepatitis, it will lead to HCC or cirrhosis. So prognosis is bad, fate is bad. So yeah, C is bad, right? So C leads to chronicity. The most common chances of converting chronicity 70 to 80% is in C. Fan is not working. So 70 to 80% it is in C. It is in C, right? So out of these, many die and many develop cirrhosis, many develop cancer, right? Only 15 to 20% will be acute. So you have to understand these percentage. So what you will find in the blood of this patient. So this is a patient in front of me with hepatitis C. Hepatitis C. I'm suspecting the patient is having hepatitis C. Hepatitis C, right? Incidence and prevalence is low, but yeah, it occurs. So hepatitis C है इस person को. I'm suspecting. So if I take the blood sample of this person in a test tube, in the blood, I will find out, number one, the virus itself, HCV virus, I will find in the blood, and I will find antibodies against HCV. So anti-HCV antibodies. Like B have three type of antigen, three type of antibodies, S, E, and C, and antibodies corresponding, right? C do not have S, E, and C. So what does the C have? तो C के antigen क्या है जिसके against antibodies बनेगी? यहाँ पे भी antibodies are of three types depending on the three type of antigen. So what are the three type of antigen in hepatitis C virus? So you will find in the blood the virus itself, the virus, and antibodies against the virus. Antibodies are of three types. So you have to see the diagram of this virus. This is the structure of hepatitis C virus. There are various antigens present on this virus. You can read the name. Antibodies are formed against the C100C. It is C100-3 fraction. It is the name of fraction. Antibodies are formed against C33. And antibodies are formed, I guess, against NS2 and NS1. So there are various antibodies which are formed against these fraction. You can learn this is 100C, this is C33, and this is NS5 and C22. So these are the name of the various antigens against which antibodies are formed. If you want to learn, that it is given in Robbins, you can learn this sequence also, but not very important, but you can learn. So you can see antigen, the virus itself is coming, and the three type of antibodies, you can see the three type of antibodies I will show you. The three type of antibodies. So first antigen, the virus itself is coming, and then body is forming three type of antibodies against it. You can see the first antibody which come is 103. The second is 33C, and third is NS5. I know difficult to learn, but please keep it in mind. So that is about C. That is about C. Now, please understand these antibodies are of two types, IgM and IgG. IgM is acute and IgG is chronic. But chronic there, हमें वहाँ पे भी था chronic. The chronic that is IgG antibodies are present forever. In hepatitis B, these IgG antibodies are protective in nature. But in hepatitis C, IgG antibodies are not protective. That's why we don't have vaccine for hepatitis C. Now, you yourself told me now a few minutes back that hepatitis C is more dangerous, ma'am, as compared to hepatitis B because there are more chances of converting chronicity in C as compared to B. You yourself told me. So my question to you, why don't we have vaccine for C instead of B? We have vaccine for B, but we don't have vaccine for C. So there are two reasons. Hepatitis C virus show antigenic variability like COVID. So we create the vaccine against one antigen, the antigen is changed. So the previous vaccine is not applicable on the current variant. Number one. And number two, if we make the vaccine also, the antibodies after the vaccine are not protective. So that's why we don't have vaccine for C. The next virus is D, hepatitis D. D for defective. D for defective. D का मतलब होता है defective. What do you mean by defective? He always need a friend. The friend is B. The helper virus is the B, without which it cannot cause hepatitis. So there is a human being. If only D alone is entering, he cannot cause hepatitis in this person. He can cause hepatitis if it enters along with B or B is already present in the person. Have you got it? Have you got it? So it requires a combination. So D requires a helper. The helper or the friend is B, and that's why D is known as defective. Everyone give me a thumbs up. Everyone. So D is defective. It requires a helper. The helper is HB, hepatitis B virus. Right? That is the thing. Right? Now here two scenarios are there. The last point which I want to explain and end the lecture. The two scenarios are there, co-infection and super-infection. What do you mean by that, co-infection and super-infection? There are two persons. This is person 1A and this is person B, right? So D is entering in both of them. D is entering here, hepatitis D, and hepatitis D is entering here also. Here D is entering along with B. And here D is entering alone, but B is already, he is a carrier of B. The person is already a carrier of B, asymptomatic carrier. So in both these scenarios, the person will have hepatitis because combination is there. But you can see in the first, both are entering together. That's why known as co-infection. And in second, B is already present and D is entering ahead. So it is known as super infection. Have you understood the term co-infection and super? In co, both are entering together. In super, B is already present and D is entering from the ahead. So what is the difference? You will say, ma'am, ultimately the person will have hepatitis D. How does it matter if both are entering together or separately? How does it matter for us being a doctor? It matters. It matters. Why it matters? See the percentage. If it is co-infection, listen everyone, 90% will have acute and recover. Hardly 10% will have chronic if they are entering together. 10% chronic acha nahi hai, acute chalega, right? If it is super infection, the person is already a carrier and D is entering. Here they are entering together. Here B is already there and D is entering ahead. That is super infection. So 80% will have chronic. Instead of 10, 80% will have chronic and only 10% will have acute. Give me a thumbs up. Give me a thumbs up. So which is bad? Which is more dangerous? Co-infection or super infection? So chronicity here is 10% and chronicity here is 80%. So of course, super infection is dangerous. So that is the point. Again, you should take in consideration, right? So I have to end the lecture here, but discussion is not ended yet. I will continue the discussion in open house. So please join me, everyone. I request everyone, those who are listening me, join me on open house. You know what is open house? um, in the chat of this, go at the starting in the chat, there is a link provided to you. The link is of the open house. Just click on the link. I will end this lecture. After end of this lecture, click on the link. So you will connect it with me on an audio call in an audio room. We all will be connected. We cannot see each other, but we can hear each other. So if you want to talk to me directly, you can't talk me right now. You can talk me in chat. But if you want to talk me directly, speak to me. So just send me a request. I will accept your call, unmute yourself and talk to me, ask your doubts. Your doubts related to hepatitis, doubts related to the study, doubts related to the exam pattern preparation, you can ask me anything. I will answer your doubts. So please everyone join me open house immediately after ending this lecture. Click on the link. The link is given in the chat of this lecture. See the chat. Go ahead. In the beginning, in the chat, there is a link of open house. So please click. Next class is tomorrow. Tomorrow I am going to teach PSM epidemiology, the case control and cohort study. So not on this channel, on UA Live. I will teach on YouTube only, but another channel of Unacademy, that is Let's Crack NEET PG. So please everyone join me on Let's Crack NEET PG and subscribe that channel also. It is also a Unacademy YouTube official channel, YouTube channel. So I will teach you entire numericals there, right? So thank you very much for being with me. Yeah, please everyone give the All India mock test, which is going to happen on 26th Feb. And please everyone participate in the combat test, which is going to happen on 19th Feb. It will be useful for you. And today is the last day for grabbing 20% discount on Plus and Iconic subscription instead of 10. If you use my code Sachdev10, SACHDEV Sachdev10, instead of 10% discount, today if you take the subscription, you will get 20% discount. For Plus also, for Iconic also. So you can see how much you can save. If you are, this is the normal price, this is the price we are offering today. So see the saving for Plus and same with the Iconic. So please use the code Sachdev10. Today is the last day of the offer and you can really take it if you are planning to take the subscription. Thank you very much. I'm ending and join me immediately just in 2 minutes in open house. Bye-bye.